Cancer is the second leading cause of death in the United States, but if cancer is detected in its early stages, chances of survival are much greater. Here to talk about the importance of screening is Dr. Apeksha Desai of ACE Primary Care, a contracted provider for Optum Care Network Nevada, sponsors of this segment. Doctor, thank you so much for being here today.
Thank you. Thank you so much for having me. So you're right, cancer is responsible for almost 20% of all deaths in the United States. However, a lot of those deaths are preventable with screening tests when done early to detect those cancers early before they've had a chance to develop symptoms, grow, or spread.
What type of cancers does a screening intercept?
Okay, so the CDC supports screening for colorectal, breast, lung, and cervical cancers as recommended by United States Preventive Services Task Force.
So how often and how many screenings should one person get?
So it depends on your risk factors and your age, but almost always everybody would benefit from having screenings done for these kinds of cancers. So mammograms are the best screening test for breast cancer, and most women will benefit from starting around age 40. Their frequency can depend based on their individual risk profile. But when detected early, it's much easier to treat and cure breast cancer. For colorectal cancer, now the recommendations are to start screening at age 45. Colon cancer mostly develops in precancerous polyps, and when detected early, they can be removed before they become cancerous.
Are the home tests that I've seen advertised, are those effective, or is it better to go ahead and get the full screening?
No, actually the home tests, so some of the home stool tests, like you may have heard of Cologuard and such, those tests can be pretty good for the right candidate. So if you have history of polyps, then those are not good tests. So for certain candidates, it's a good test. Also, if you've never had a colonoscopy, it's a good idea to have at least one.
Yeah. And how can doctors help?
Well, first of all, we want to make sure that patients feel comfortable talking to their doctors about screening. If you don't see a doctor or haven't been to a doctor in a long time, make sure you go to your doctor and bring up screening so they can advise you regarding tests that are appropriate for your age and risk factor profile, and get you going with those tests. And if your doctor recommends a test that you're not comfortable with doing for whatever reason, speak up, say so, and then they might be able to offer you various options and alternatives, like we discussed, that there are more options now, say for colonoscopy and others. So the most important thing, though, is make sure you talk to your doctor, and don't hesitate to bring up your concerns, and they can work through it.
Well, Dr. Desai, this is life-saving information. We appreciate you being here very much. You want to thank Optum Care Network Nevada for sponsoring this segment. You can call them at that number on your screen or visit optumcare.com/Nevada for more information. We'll be back.